Prison. You're right, she should have been back by now. But nothing's wrong.
Obviously, we are having some technical difficulties with the J.B. Pritzker news conference from Chicago. When we solve our problem, we'll rejoin that news conference. Meanwhile, we return you to regular programming.
On the city's south and west sides. These FQHC in Madison County. What Anderson and Lurie are doing, looking beyond their front doors to see how they can help, this represents the very best of Illinois. I can't thank them enough. No community is getting through this alone. The fastest way through is maximizing our resources across Illinois, and these hospital labs are stepping up to make that happen for all of us. I'm also excited to announce that our new state-run South Suburban Drive-Through Testing Center will open early next week in the Markham-Harvey area. We'll be taking hundreds of specimens per day, with test results coming back to patients much faster than the federally contracted labs. As for our existing 2 state drive-through sites, we've secured an extension of our federal contracts while we work to transition these sites to run entirely through state and local labs for faster test results. Testing is crucial, but we also need to talk about what happens after a person gets a test, or doesn't get a test but has symptoms, or has a known exposure to COVID-19. How does that person protect themselves? How do they protect their family members, their roommates, their loved ones? Across the state, we have multi-generational families living under one roof. And especially in our cities, we have families and roommates living in smaller apartment units that make self-isolating much, much more difficult. As part of our early crisis preparations, we required each of our local jurisdictions to come up with an alternate housing plan to help residents quarantine in a safe place. Simultaneously, we at the state level began preparing up to 2,000 hotel rooms outside of Chicago to support suburban and downstate communities. When a local health department needs help beyond its local alternate housing plan, we can open the provision of these hotel rooms for additional capacity. We have rooms available in Springfield, Rockford, Metro East, the Quad Cities, Schaumburg, Mount Vernon, Peoria, Carbondale, Quincy, Marion, Macomb, Champaign, and the Collar counties ready to be activated by next week based on county needs. We're also providing support to the city of Chicago and Cook County in their own efforts. These hotel rooms are for people who tested positive for the virus but have low-level symptoms and don't need hospital-level care. There are other rooms available for people who were exposed to a COVID-19 positive person and are therefore a person under investigation who may need to move out of their home as a precautionary measure to make sure that they don't expose their families or their roommates. This extends to our first responder communities especially. Local health departments will be making decisions about these housing needs. We've utilized the full weight of IDPH's clinical and technical capacity to bolster our local health department's COVID response, and we're now directing a combined $6.8 million to help mitigate every health department's financial stress during this crisis. I want to remind people that these hotel rooms are in addition to the alternate care capacity at McCormick Place, at Westlake Hospital in Melrose Park, Metro South Hospital in Blue Island, Sherman Hospital in Elgin, and Vibra Hospital in Springfield. Additionally, I'm very pleased that the federal government has granted our request to use the VA hospital system to support COVID-19 patients as medically necessary. I also want to recognize the Illinois Primary Healthcare Association and its vast network of community healthcare centers who are working so hard across the state to support and improve the health of our residents. From cities to rural towns, these centers already played a critical role in public health through their support of many of our most vulnerable residents. And in the midst of a pandemic, they are one of the first lines of defense against COVID-19. This week, 45 community health centers across Illinois are receiving more than $51 million through the bipartisan Federal CARES Act to sustain their response to this virus. I also want to provide an update on our Abbott rapid test distribution. As I mentioned on Wednesday, Illinois received 15 rapid test machines. While we're still working to acquire the necessary materials to scale up their use beyond the 120 federally provided tests, we are deploying these machines in the following manner so that they're ready to go as soon as the new tests come in. 7 of these machines are going to the federally qualified health centers that I mentioned earlier, 2 each to Chicago's south and west sides, and the remaining 3 to East St. Louis and the surrounding region. Another 3 will go to the Illinois Department of Human Services facilities, the Ludeman Development Center in Park Forest, the Shapiro Developmental Center in Kankakee, and the Elgin Mental Health Center. And the final 5 will go to the Illinois Department of Corrections facilities, Stateville, Logan, Graham, Dixon, and Menard. To close, I want to say that we're making sure that our plans reflect equity in access, in testing, and in treatment. And we're asking the same of healthcare providers across the state. It is essential that healthcare institutions operate to fulfill their obligations to render healthcare in an ethical and non-discriminatory manner. This is a crisis, and providers may have to operate beyond their normal capacity and allocate limited healthcare resources. No one life is any more important than another. Today, we issued guidance that vulnerable and historically marginalized communities must receive equitable care so that no person of color or person with disabilities suffers a disparate outcome due to a legacy of discrimination. It's in moments like these that we owe each other even greater expressions of humanity. And with that, I'd like to turn it over to Dr. Ezike for our medical update today.
Thank you, Governor, and good afternoon, everyone. I'm inspired by your commitment to make sure that all lives matter and that everyone gets equal care. United, we stand, and divided, we fall. I'm inspired by all of you who are following the recommendations to make sure that we do all that we can to ensure the safety of our entire community. Unfortunately, today I must report that 68 additional lives have been lost to COVID-19, and there are 1,465 new cases. That brings our total to 596 lives lost, and a total of 17,887 cases. Health disparities and inequalities are major concerns to me as the public health director, and I've always encouraged our agency to use a health equity lens in every aspect of the work we do. In our COVID-19 data, we see alarmingly high rates of COVID-19 in the Black population. This disparity is true both for cases and in the deaths. Overall, mortality rates among Blacks are 5 times higher than whites, and when you break it down by age groups, the disparities are even higher. For people in their 50s, the mortality rate is 12 times higher for Blacks than their white counterparts. For people in their 60s, the rate is 8 times higher for Blacks than their white counterparts. For people in their 70s, it's 10 times. Comorbidities and underlying health conditions, yes, they often contribute to more severe illness from COVID-19 and death. We know that African Americans generally do have higher rates of heart disease, stroke, cancer, asthma, diabetes, and Black adults are nearly twice as likely as white adults to have higher rates of obesity, as per the National Institutes of Health. Black life expectancy continues to be years shorter than the population as a whole. And there are many reasons for this. And let's not, of course, forget the centuries of structural and institutional racism. Additional issues that worsen the COVID-19 disparities include having jobs that put people at higher risk of exposure, being underinsured or uninsured, lacking access to regular medical care, and the fact, as Governor Pritzker mentioned, that Black populations potentially live in extended family settings with more people in the same setting. As the governor mentioned, the state is working on alternative housing and communities of color to address some of these challenges of people who live in close communities and who may be at risk or who've already been found to be positive. At IDPH, we've also created the COVID-19 Equity Team. It's comprised of our director for the Center of Minority Health, and it involves other state agencies as well as many community organizations that will serve as the voice and the informational hub on how to accurately address health disparities. We will not stand idly by while one segment of the population bears an unfortunate heightened burden of this disease. The equity team will identify emerging issues and patterns impacting medically and socially vulnerable communities while assessing and proposing specific actionable recommendations. Testing must be increased among the disproportionately affected populations. This will allow for earlier, more effective isolation and segregation of the exposed individuals. Starting today, the Health Equity Team launched COVID-19 text messaging. You can opt in to receive text messages so that you can have the most accurate information about coronavirus and how you can protect yourself. Simply text the word COVID, C-O-V-I-D, to 312-500-3836. Or for Spanish, text COVID ESP to the same number, 312-500-3836. We must address the dramatic disparity we're seeing. We got to tackle it head on, and we hope that these steps will start to do just that. I want to reassure the people of Illinois that we are working for the health and safety of all people of Illinois. We won't hide from the hard truths, but rather elevate the truth and then address it. We must all continue to stay at home. We must all continue to wash our hands. We must keep our 6 feet of distance so that we can turn the tide and end this pandemic as soon as possible. And with that, I will summarize the comments in Spanish. Solo somos tan fuertes como somos unidos y tan débiles como somos divididos. Una cita de J.K. Rowling. Me inspiran todos los que están siguiendo las recomendaciones y ver que están haciendo todo lo posible por su seguridad y de las personas a sus alrededores. Desafortunadamente, hoy debo reportar una pérdida de 68 vidas más relacionadas con COVID-19. Hemos perdido un total de 596 vidas en esta batalla y ahora tenemos un total de 17,887 casos aquí en Illinois. La disparidad y la inigualdad son temas preocupantes para mí como líder de salud pública y siempre he animado a todos a usar sus lentes de equidad en la salud. En nuestros datos del COVID-19 estamos viendo tasas alarmantes de COVID-19 en la población de raza negra. La disparidad aplica al número de casos y también al número de muertes. Sobre todo, La tasa de mortalidad es 5 veces más alta en la raza negra que en la raza blanca. Y dependiendo en la edad, la disparidad es aún más grande. En conclusión, la raza negra está enfrentando riesgo más alto cuando se trata de la enfermedad causada por el nuevo coronavirus. Lo que se llama comorbilidades o condiciones subyacentes suelen contribuir a enfermedad más grande por COVID-19 y hasta la muerte en algunos casos. Los adultos de raza negra tienen doble probabilidad de tener diabetes de acuerdo con los Institutos Nacionales de la Salud. De acuerdo con el CDC, la esperanza de vida de la raza negra ha sido varios años más corta que la población general. La disparidad tiene que ver con los trabajos que llevan más alto riesgo de exposición, falta de seguro médico, falta de empleo, menos acceso a servicio médico constante y grupos más grandes viviendo en viviendas comunitarias. Como ya mencionó el gobernador, el Estado está trabajando para crear otras opciones de vivienda en las comunidades de color para abordar el desafío de vivir en comunidades encogidas. Además, hemos creado un equipo de equidad para el COVID-19, compuesto por agencias estatales y organizaciones comunitarias que servirán a comunidades socialmente vulnerables, y después se va a proponer recomendaciones justiciables. Debemos incrementar las pruebas en las poblaciones afectadas desproporcionadamente para permitir medidas de intervención y cuarentena más rápidas. Empezando hoy, usted tiene la opción de recibir mensajes del Departamento de Salud Pública en Illinois para obtener información precisa sobre el coronavirus y saber cómo protegerse. Simplemente envíe la palabra COVID al 312-500-3836. Para mensajes en español, envíe las palabras COVID-ESP al mismo número, 312-500-3836. Debemos prestar atención a la gran disparidad que estamos viendo y esperamos que todos estos pasos nos ayuden a realizar esta meta. Debemos seguir quedándose en casa, lávese las manos y seguir manteniendo una distancia de 6 pies entre personas para cambiar la marea y darle fin a esta pandemia más rápido. And with that, I will turn it over to Dr. Horace Smith.
Thank you. Thank you. Good afternoon, everyone. My name is Dr. Horace Smith, and I stand here today in dual roles. I'm a physician at Lurie Children's in the Department of Hematology Oncology Transplant. Have been there since 1978, but also I'm a pastor of one of our churches on the south side of Chicago. I am so happy to be here today because of the work of our governor, of our mayor, of all the health professionals, and of the communities that today are announcing, I think, some tremendous strides forward in our fight against this pandemic. These subjects today about disparities in healthcare are not new to us, but often they get pushed to the side. I can remember about a week or so ago when the announcements were made about the disparities of numbers of cases of COVID-19 in the African American community and mortality, and people were astounded. But I will say to you that for many of us, we were not surprised. These are issues that have been in these communities for a long time. And oftentimes, because of the ability for us to ignore what's happening, it takes something catastrophic for us to really pay attention that these communities don't only need help today, and what you were being announced about the testing and about availability, but really I want to praise the governor and our mayor and all those who understand that these are endemic, long-standing issues. We must deliberately, with all of us together, face the unpleasantries of what's happening in our nation. It is a very unique situation that African Americans and Latinos and others who have been vulnerable for a long time are hit the hardest. In Scripture, we are taught that we owe the most to those who have the least. And so we must not ignore this. We must not be divided by it. We must do what's being done today. We must make sure that supplies of health care are available. I would caution all of us to understand these disparities. Health care is a trust issue. If there's a community that does not trust institutions, you can live next door to a hospital, but you will wait until the last minute to go to the emergency room. That is not good health care. If there's no trust, then there will not be accessibility. And so as we open these centers, I'm so glad to hear them opening on the south side and the west side, where the people are hit the hardest. And I would speak to my fellow neighborhoods and community and tell them, please continue to observe hand washing, observe social distancing, observe wearing your mask outside. But also I want to encourage you to not be afraid, to get tested. The next step in the fight against COVID is going to be universal testing. If we have a community that's vulnerable in small spaces, and yet they have all these comorbidities, we should not be surprised by the vast numbers who are infected and those who are dying. As a pastor and as a leader in the healthcare community.
You have been watching a COVID-19 news conference with Illinois Governor J.B. Pritzker. It was announced that there have been 68 more Illinois deaths and more than 1,400 new COVID-19 cases. The St. Louis Metropolitan Pandemic Task Force is currently having its daily press briefing. We join that live.
Submitted by members of the media. Reporters who have questions during the briefing can submit those to the task force public information contacts. We will address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, good afternoon, and thank you for your time as we talk about where we stand on the COVID pandemic entering into this holiday weekend. I wanted to take a couple of minutes to reflect on conversations that I've been fortunate enough to have with some of our frontline healthcare workers today as I was out and about. And what I saw and heard was truly inspiring. Although many of them have settled in on the new normal, there's still anxiety about personal protective equipment, and we've talked about that quite frequently in the past. But however, one of the things that was a bit surprising to me is I was told that people are now requesting to work on dedicated COVID units. And so when I asked the staff why they were wanting to work on a COVID unit, they told me a lot of different things which were quite inspiring. Some of them said, this is what we do, and this is what I went into healthcare for, and this is where I'm needed the most. Others said things like, well, we want to limit the exposure to some of our fellow healthcare workers so that they don't have to take the risk of being exposed to COVID. One nurse talked about how in their 30 years of nursing, they had never experienced such camaraderie or esprit de corps in their unit. And lastly, my favorite was, we're going to kick this virus's butt. So I want to thank you so much for all of the frontline staff that allowed me to come and talk with them today. It was a really inspiring experience. I also want to share with you a couple of other announcements. We've been working to strengthen our lines of communication with our emergency operations centers across the metro area. And so I'm pleased that as of today, we have a liaison officer who's a bit now, and you'll notice I'm wearing some AirPods, and it'll become apparent here in a minute. This is an incredibly stressful and sad time. So before I update the numbers with you that we've been sharing every day, we wanted you to hear from a mental health expert about the impact of this situation. And as you know, mental health is a critical component of the public health picture, and we have to focus on attention to this as we work our way through this crisis. So I'm really happy to introduce one of the area's leading experts on mental health, and this is Dr. Timothy Bono. Dr. Bono is a psychology professor at Washington University in St. Louis, and he joins us now remotely to share an overview on strategies and tips to address psychological well-being during this difficult time. So, Dr. Bono, thank you so much for sharing your thoughts with us.
It's my pleasure to join you today, Dr. Garza. As you mentioned, this is an incredibly challenging time for all of us right now. And so in the interest of maintaining our mental health right now, I'd like to share with you 3 behaviors and 2 mindsets that I believe can be helpful for us in the current situation that we're in. The first of those behaviors has to do with restoring a sense of autonomy. Part of what makes this situation so challenging is that it can very easily feel like things are spiraling out of control. And so it becomes very important then to maintain focus on those things that are still within our control. Things like getting exercise on a regular basis, or cooking our favorite meals, or why make it difficult to do that. It's okay to focus even on those behaviors that are small in nature. Even things like starting our day by cooking a good, healthy breakfast, or taking a walk around the neighborhood, or even something as simple as making our bed each morning, because the sense of satisfaction that comes from accomplishing even a small goal can motivate us to accomplish larger goals later in the day. And that sense of accomplishment can be very important for our overall psychological health. And the third behavior, which is arguably the most important, is finding a sense of relatedness, because we know that maintaining connections with friends and family members, even if that's through video chat or virtual happy hours or a good old-fashioned phone call, that really is one of the most important ways to maintain psychological health, really at any time, but especially during a crisis. So in addition to those 3 behaviors, there are also 2 mindsets that I believe are very important as well. And the first of those is to give yourself permission to be human, which is to say, allow yourself to feel whatever it is that you are feeling. It's natural to experience sadness or anxiety or other forms of psychological distress at a time like this. Inevitably, there will be days where we're not able to make as much progress toward our goals as we had hoped, and that's okay. On those kinds of days, it's important to practice self-compassion. Go easy on yourself. And then when you can, turn attention back to about what the economy is going to look like, about what our jobs are going to look like, and about what our health is going to look like. And certainly it's important to be thinking about those things and planning for them, but it's also important not to get too far ahead of ourselves and to be taking things one day at a time and asking ourselves, what do those things look like today? What can I be doing today? And what can I be doing to work as hard as I can on those things based on the information that I currently have available to me? So incorporating those 3 behaviors, finding opportunities that promote autonomy, competence, and relatedness, and then giving ourselves permission to be human, taking things one day at a time, I believe that approach can position us for a sense of well-being even amid these very challenging times that we are all in. And with that, Dr. Garza, I will hand things back over to you.
Great. Thank you, Dr. Brown. I really appreciate your time with us today. So we're going to now and move over to some of the numbers that we've been sharing with you over the course of the past 7 days or so. So again, these data are the combined figures from our 4 major healthcare systems that are part of the task force. So as you can see, hospitalizations are down from yesterday from 611 now down to 160. Across the healthcare systems, we've had 36 COVID-19 patients that were discharged yesterday. Now, those numbers are down a little bit over the past 24 hours, but as you've heard me say repeatedly, we don't track those numbers significantly from day to day. We're looking at long-term trends. And you've heard me say repeatedly that we're still on the upslope of the curve, and we have to be very mindful that we know that the surge in patients is going to be coming in the next couple of weeks. So again, we need to do everything that we can to limit the amount of exposure, to limit the spread, limit infections, so allow those healthcare workers that I spoke about previously to do the jobs that they are meant to do. On the capacity question, and I know there's a lot of interest in capacity in the healthcare systems, and I've been sharing a lot of numbers this week. So as of today, those numbers that we've shared, we're able to handle. We're handling it okay with the capacity that we have. We're going to continue, though, to urge everybody to do their part to keep those numbers low. And we're going to be working as well as a team here to get a little bit better understanding on the capacity numbers so we can give a little bit more clear idea on how we're performing. And lastly, I know this is a holiday weekend, and I know it's generally a time when families and friends come to keep practicing our hand hygiene, washing hands, washing surfaces. So, and this will all pay off in the long run. And with that, I'm happy to address some of those questions that we've received from the media.
Dr. Garza, how is zip code and racial data collected? Are hospitals reporting the information to counties, or are patients required to submit it themselves to the county?
So as far as patient data submitted to the county, so there's a couple of different ways that we look at this. So one is the CDC form, which is called the Patient Under Investigation, or the PUI form, where some of that data is captured, which is then sent to the CDC and the health departments. And so they do get data that way. The second way that we look at it is we're beginning to collect data from the hospital level, which we routinely do just to look at our demographics and things like that. So we have built a system where we can pool the population of COVID patients at the patient level, so then we can start doing that analysis as well on race, ethnicity, zip code, all of those other things, so we get a better picture on who is at risk and what is the population of patients that we're treating.
Dr. Garza,
and identifying individual patients. So no, I don't have information on that.
how long do COVID-19 symptoms last? Is it comparable to the flu?
So it's different for every patient, right? And so as I've told, as I've mentioned before, some people are completely asymptomatic, and so you can go from asymptomatic to being very sick. Now it's a viral illness, respiratory viral illness, so it typically lasts anywhere from around 10 days to 2 weeks. Typically when we're asking patients to self-quarantine, we tell them to self-quarantine if they have exposure or something like that for up to 14 days, because we think that's the optimal amount of time that all of the symptoms would have passed, and they wouldn't be exposing anybody to virus after that.
For COVID-19 patients who are hospitalized, are they...
You've been listening to the St. Louis Metropolitan Pandemic Task Force, where Dr. Timothy Bono of Washington University discussed the importance of our psychological well-being during this challenging pandemic. We will have the latest news and information on 5 on Your Side at 4, as well as the KSDK app and KSDK.com. Missouri Governor Parson is giving an update on the state response to COVID-19. There have been over 3,700 cases and 96 deaths as of 2 p.m. today. He announced that he has signed the supplemental budget passed by the General Assembly. This will provide funding for PPE for those on the front lines battling COVID-19. Head to KSDK's Facebook page to continue to watch the governor's update. We now return you to the Ellen DeGeneres Show.